Alors, bonjour à tous, chers collègues. Bienvenue à cette conférence de presse pour faire le point sur la situation au Québec quant à la COVID-19. Le premier ministre du Québec, M. François Legault, est accompagné de la ministre de la Santé et des Services sociaux, Mme Danielle Mécan, et du directeur national de santé publique, Dr. Horacio Arruda. Monsieur le premier ministre, à vous la parole.
Merci. Bonjour tout le monde. Je commence avec le bilan de la dernière journée. On a 109 nouveaux décès, pour un total de 1243. Donc, mes pensées sont avec toutes les familles, les proches des personnes qui sont décédées. On a maintenant 21 838 cas qui sont confirmés. C'est une augmentation de 873. On a 1411 personnes hospitalisées. C'est une augmentation de 133. On a 207 personnes aux soins intensifs. C'est une augmentation de 8. Notre priorité, ça demeure de trouver du personnel dans les CHSLD, mais je dirais dans l'ensemble du réseau de la santé. On a actuellement 9 500 personnes qui sont absentes dans l'ensemble du réseau. Et juste au cours de la journée d'hier, c'est 800 de plus qui sont ajoutés. Donc, 8 500. On sait qu'il y en a à peu près 4 000 qui sont infectés. Ça veut dire
that there's about 5,000 who are infected. That means that there are 500 who are absent for other reasons. Amongst that, we know that other people fear catching the virus, and I think that we cannot judge anybody. We have to understand them. However, you will understand that a network where we have a situation that is more difficult than usual, with 9,500 people who are absent, it's huge. So today, I wish to launch a call to those people who are at home, who in certain cases are completing a 14-day period after having been infected. We need you. We need you. First, I'd like to repeat it. We have all the individual protective equipment. There are clear guidelines sent everywhere to take no chances, no risks for your safety. So I ask you, we need you. The network cannot function with 9,500 people who are absent. I would also like to take advantage of this opportunity to say that the 4% and 8% premiums that were supposed to finish on the 30th of April will be prolonged to the 31st of May. I understand that it's not necessarily a question of money, but still, this situation, it's a recognition that we're giving you. I would also like to say that for orderlies, the bargaining is going ahead very well, I've been told, with the unions, so that we'd be able to increase the wages of the orderlies in a permanent way. So my message is quite clear. The 9,500 people, I'm thinking about the 5,500 that are not infected, we need you in the health network. I'd like to get back.
Le bilan.
I'd like to go back to the numbers. So we have 109 new deaths in the course of the past 24 hours for a total of 1,293. 93 of those come from the residences for the elderly, whether they be CHSLDs, RPAs, RIs. It's not less important or significant because they come from those residents. What I wish to say with that, to go back with what I was explaining yesterday, in Quebec we really have two worlds right now. We have the world of CHSLDs and then we have the rest of society where the situation is pretty much under control. And I'd like to get back to the concerns that certain people have. Certain parents, for example, on the reopening that we will be announcing next week. First, I want to clarify one thing. When we're saying that we'll be announcing a plan next week, there's nothing that is going to open next week. It's just that we're going to be presenting a calendar for the coming weeks. First, to tell you that when we look at the death rates up until now, 97% of deaths are of people who are 70 and over. So people who are younger are truly at very little risk. What we also know is that there will probably not be any vaccine against COVID-19 for many months, perhaps even a year, or perhaps even 2. So we have a situation where I want to try to explain the concept of natural immunity. I know that it's not simple, and I will try to do so. Right now we have a virus that is very powerful. And the multiplication factor is between 2 and 4. Let's say that it's of 2. That's already a lot. I know that for all sorts of reasons, you've already made that calculation in your mind. If one person infects 2 people, and those 2 people infect 4, and those 4 infect 8, and then 16, and 32, 64, etc., that is what we call exponential growth, and that goes very quickly. If, however, and that's important to keep in mind, according to the specialists, a person who has had the virus is immunized at least for a certain amount of time. Let's suppose that half the population is immunized. We're not there at all. We're below 10%. But let's say that we eventually get to 50% of the population being immunized. That means that if I go back to my example of one person, rather than infecting 2 people, that person is only going to infect 1 person. So rather than having 1, 2, 4, 8, 16, we'll have 1, 1, 1, 1, 1, 1. So you see, the situation would be a lot more under control if we managed to have a part of the population that would be immunized. It's what specialists call natural immunity. So what we've done in the course of the past month is to slow down the spread. So slow down the 1, 2, 4, 8, 16 by asking people to stay at home. However, if everybody stays at home, the situation remains the same. And we end up in a situation where we have to wait for the vaccine, which is going to happen a year, perhaps 2. We can't ask people to stay at home for 2 years. So the idea is to go very gradually, so that those people who are not at such a high risk can develop the antibodies and be able to become immunized. However, we have to go very gradually. I want to repeat that word, gradually. So, just to understand, if everyone remains immunized, if everyone remains at home, nobody is being added in that group of immunized people. So the risk that we're faced with if we keep everybody confined for months to come is that we might, the worst thing to do would be to tell people, let's all go out at once in September or in the fall. That would be the very worst thing to do. In that case, we could imagine a wave that would be even bigger than the one that we've been experiencing in the past month. So we have to take advantage of the next few months before the fall to very gradually start deconfining. Because on top of that, in the fall, there's the flu virus that will be added. So it could be very serious to say we are delaying everybody coming out until the fall. So we have to go gradually. And I want to repeat this. We're going to be presenting a calendar next week for the schools, for businesses. This is a calendar. Nothing is opening next week. It's a calendar that will be readjusted as we go along by Dr. Arruda's team. That is to say that in looking at the evolution of hospitalizations and all the data, the R0, to see the number of people who are infected in each region of Quebec, we won't be opening anything before we have the okay from Dr. Rood and his team. I just want us to be very clear about that. And on top of it, I was saying it, for parents who, despite everything, continue to have concerns, it will not be mandatory before September, for the spring period, to send your children to school. However, I repeat it, the concept of natural immunity is not a question of taking children like guinea pigs. It's to say the people who are less at risk, so people who are less than 60. There can be a natural immunity that will prevent a wave. And the reason, once again, why we wish to avoid that wave is to avoid losing control in the health network. Now, we've lost it a little in CHSLDs, but we've kept it solidly in our hospitals. So we don't want our hospitals to get overwhelmed because we go out too quickly and all at the same time. So that's what I wanted to say. A word on protective equipment. First, to say that the masks, whether they be procedural masks or N95 masks, as well as the gloves, there's ample amounts for the next few weeks. There's no worries to have. Where things get tighter, where we only have a week's worth thereabouts, is the gowns. But now, thankfully, we've been working very hard over the past few weeks convincing companies here in Quebec to start manufacturing them. And there are companies that are starting right now to deliver gowns to us. And we believe that with those volumes that we're starting to receive, it's going to allow us to have enough to get through. So my daily thanks, you can see me coming with this, is to thank the owners of those companies and the employees, because I know that in some companies, not all of them, but in some of them, they're working night and day manufacturing gowns for our medical staff. So I wish to name those companies. I wish to thank the employees of Delfab, Georges Couvé, MIP, Le Château, Logistique Unicorp, Samuelson, Second Clothing, Sean, Tricot-Liès, and Vêtements SP. Thank you very much indeed to both the employees and owners. It's thanks to them that we'll be remedying our situation of the lack of gowns for all medical staff. I would like to end by telling you that we are experiencing a period which is not easy. Not easy for the team, not easy, of course, for all the staff that is at the front lines with the patients, in particular in residences for the elderly. But we can't let ourselves be trodden down. On the contrary, it is time to work together and to take care of those most vulnerable amongst us. We owe it to them. And I want to be very clear. It's not the time to look for guilty parties. We'll have time to do that later. It is time to be united, to really roll up our sleeves and take up the challenge. And if we do this together, we'll get through it together. Thank you. English.
Good afternoon. We're going through tough times, but it's no time to be discouraged. It's time to help each other out and to stay united. Our priority remains to increase the staff in senior residences. I want to thank everybody who's coming as reinforcement to help our elderly. And I have a message for health workers who have finished their quarantine. Please come back to help us. We need you. So we must continue all our efforts. We must stay united. That's how we'll get through this together. Thank you all.
Merci, Monsieur le Premier ministre. Alors pour
Thank you, Mr. Premier, for the question period. We are going to be starting today with Mathieu Dion of Radio-Canada. For things to be clear, with the research of group immunity of 60 to 80%, are you telling Quebecers most of you are going to catch COVID-19? It's too bad, it's scary, but we have no choice? What we're saying is that there has to be immunity to be developed over the course of the next few months. I don't think that if we made a big survey and a referendum that Quebecers feel like staying 2 years at home, and it could be that before we get a vaccine. So there has to be, yes, an immunity, but very gradually. And of course, through all of that, we have to protect those people who are most vulnerable. That is to say, the people who are 60 and over. So those who represent right now 97% of the deaths. But what percentage, according to the different regions? Well, of course, the more there are people who are immunized, the less of the risk of having an exponential increase. At your request of military staff from Justin Trudeau, he seemed to accept, but he says right now we're seeing appalling tragedies in CHSLDs throughout the country. It's unacceptable in Canada. Our military should not be having to take care of our elderly. In the course of the next few weeks and months, we'll have to examine how we got to where we are. What do you answer? Well, listen, we have 9,500 people who are absent from work in the network. It is not unique to Quebec. We have that pretty much everywhere in the world. Either people have gotten infected or in certain cases they are at risk. I'm thinking, for example, of pregnant women. So, we can say it's not normal all we want, but we're not going through a normal situation. This is a crisis. We need hands. We have students that we are adding gradually, but we're missing hands. And there's those people from the Canadian Armed Forces that we are requesting. We're requesting to have 1,000. For the time being, we have about 100 of people from the Army who are qualified. There's another 200 who are in the north, the Rangers, who are helping the northern regions. But now, in our CHSLDs, we need those 1,000 students, and I hope that we can send them in the course of the next few days.
Oui, bonjour. J'aurais aimé savoir, vous parlez de...
I would like to know, you're talking about a gradual reopening. Have you thought, for example, of the children who are in welcoming homes who cannot see and haven't been able to see their biological parents for the past 6 or 7 weeks? Are thinking of measures to allow those parents and those children to see themselves as they could before? Well, listen, of course, we are in a situation which is exceptional. I can understand that it creates problems for the biological families whose children are in foster care. But you'll understand, I was explaining before, people have to slowly deconfine themselves, but slowly, gradually, because we can include certain people to go see their families. It's a case-by-case scenario. I think we have to be open and sensitive to that, but it has to be understood as well that we are in a situation where we are trying to avoid that too many people get together. You're talking that there's many absentees in the health network. I was wondering, the federal amounts that are given to the people who are not working, have they played a role in those absences? Well, listen, we set up a system of bonuses. First, the 4%, the 8%, and a system in the private residences of $4 an hour. We also set up a program of $400 per month for those who make less than $2,000 in grocery stores. And generally speaking, now there's a new program for the students. Of course, it may have had some sort of impact. People who are tempted to stay home and just getting money, it might have had an impact. And I think that it also has to be mentioned that the people who are at home, like the Premier was saying, pregnant women, people who are immunosuppressed, people who are infected, or people who have been in contact, who have a period of quarantine to get through, they are receiving their wages. So perhaps that what is given by the federal government, perhaps some people were drawn by that, but there are already a lot of other people that we are paying according to their usual wages.
Louis Lacroix, Cogeco Nouvelles.
Hello, Mr. Premier, Ms. McCann, Mr. Arruda. First, Mr. Arruda, what is the rate of immunity? I want to express it correctly. What is the percentage that is required in a population of people who have been infected to get what we call group immunity? Because I was reading this morning, the Pasteur Institute talks of 70%. I think the numbers, some people are saying that it's below that. In your opinion, what is the immunity rate that is required to get that group immunity that we need? It depends on each bacteria or virus as such. But in this case, well, it depends on the R0. With the R0 that had been calculated in China between 2 point something and 3 point something, we were saying about 70% to 75% of the population. There we could have a certain mass immunity. However, with R0s that are re-estimated right now in certain places up to 5 and 5.8 and even beyond in certain cohorts, well, we increase the level of mass immunity to about 80 or 85%. Just to give you an example, a very contagious virus, you need 95%. So that the virus, doesn't create epidemics. So in the case of measles, for example, but we're not at the level of measles, but we're probably around 70 and 40. We are in a bracket that I would say that is acceptable. Well, once again, it depends on the R0. Referring to what you said a few minutes ago, Mr. Legault, saying earlier on that we lost control in CHSLDs, but we've kept it in our hospitals. But more and more, we have testimonies of people who have been infected in hospitals. I'd like to quote a couple to you. A man who's 90, who Thursday went at the hospital of Sainte-Marie of Trois-Rivières for something that had nothing to do with COVID-19. He was tested positive or negative when he arrived. He came back out 4 days later, and he was positive to COVID-19. Another case, a man who's 70 who went into the Charlemagne Hospital to treat a urinary tract infection that ended up going badly because he went in negative. When he left, he was positive and he infected his wife before that woman, who's 73, was able to know that he was positive. So there seems to be cases of contamination right now in the hospitals. Well, first, I would say that the cases that you're mentioning, I think that those are exceptions. I think that the guidelines that were set up for the wearing, for example, of protection material and for the limits of hot zones, I think that in the vast majority of cases, the guidelines have been followed. When I was saying earlier on that we've managed to keep control in our hospitals, it's that we had thought that 8,000 beds would be needed for COVID-19 cases. As of today, we have 1,411 people with COVID-19 who are being hospitalized. So we still have a margin. My greatest concern a month ago was that we would go beyond the 7,000 or 8,000 in hospitals and that we'd lose control. But we've kept control very well. But there's people who have been infected in places where they were being treated for COVID. They weren't, being treated for COVID-19. Who were they infected by, staff or others? Well, that happened in CHSLDs. It happened in certain hospitals. There are perhaps guidelines that have not been followed perfectly everywhere, but I believe that it remains exceptional cases. Yes, it remains exceptions, and the guidelines are clear. And I think that in hospital settings, it is very well followed, of really having hot zones and cold zones. So these with no communication. So for somebody who does not have COVID-19, they should not go to a hot zone, of course. And the opposite is just as true. So these are exceptional cases. And of course, we would have to do an epidemiological tracing for the situation. And I, asked Dr. Ruda what may have happened. It's possible that there was an acquisition in a hospital setting. I think that nobody can say that it's impossible. What is important is that there not be sustained transmission within an establishment. And in this case, if you'll allow me, the patient that could have caught COVID-19 inside or outside arrive at the hospital, be tested negative at the first test because he's still in an incubation period, the test is not yet sensitive enough, and be tested after. So depending on how long they stayed, etc., and the time when the test was made compared to potentially any exposure. Because now you told me that he went in, it was negative and became positive, and it was 4 days that he stayed. So it's possible that he caught it in the community setting, that he was tested at the beginning of the hospital and he was tested negative, and he didn't have enough virus because the test wasn't sensitive enough to detect it. But what's important, and we know this, infections exist in hospitals. It's a place where there is, presence of bacteria, etc., and people are more fragile as well. But what is important is that if ever there are cases in a unit, that they be controlled very quickly and that there not be the sustained transmission as we've seen, for example, in CHSLDs. It's possible, but the protocols are also perhaps easier to respect because it's not a care of, a life environment. It's a care environment, hospital setting. Mr. Premier, you said it. Perhaps it's still early to be able to see what's going on, but the question can still be asked. When the time comes, are you going to ask for a public inquiry on the management of CHSLDs? The day before yesterday, Mr. Ruda alluded to it. Could it be in the possibilities of the government to really understand what happened? I exclude nothing. We will have to go over things and see what happened. At the same time, we have to understand that with 9,500 people who are absent in the health network, it's a situation that is very, very tight. And you already have a committee that is thinking about the economic recovery. You announced that there was going to be a deconfinement plan. There are many voices who say that we should think broader for other parties involved, because there's probably going to be tens of billions that will be invested, perhaps the biggest recovery plan since the Second World War. And we're also being said that you don't have the mandate, you haven't received that mandate, and you didn't in 2018 to launch such a plan. Are you going to open up discussions so that more people be involved in this recovery plan, apart from your ministers? Well, yes, absolutely. I think that we are going to have all sorts of possibilities over the course of the next few months and years, because it's a recovery that is going to be done over a period of years. For the time being, it's about saving as many companies as possible, and that is why a committee restrained to a few people, but those people as well contact others who are in different industries, whether it be in the manufacturing industry, whether it be cultural activities, whether it be touristic or tourism. So there's a lot of consultation work being done outside, and it's going to have to be done as well with the opposition parties in the course of the next few months and years, because yes, in fact, there will be a new society that will emerge from all this. And already I spoke of the importance of a greater autonomy in terms of our food, all of our medical material. So there are important adjustments to bring. We might, for example, think that there might be fewer imports of Chinese products or imports from certain countries. The importance of developing things at home, more production, more kinds of products. So these will be discussions that we'll have with the opposition parties and the population at large, with our entrepreneurs as well, because we have entrepreneurs who are changing their way of doing things. There's a lot more working from home being done, and there's going to be even more done in the course of the next few months and years. So new ways of working, of functioning, new ways as well of purchasing. Online orders already existed, but this is going to be increased. So for the transportation of merchandise and home delivery, we're going to have to develop our expertise in that domain and our network. So a lot of work to be done. And yes, there will be a debate, a societal debate that should take place around this question. Mr. Premier, last week, you offered a mea culpa to Quebecers, saying I should have increased the wages of orderlies earlier. Now, today, do you regret having especially asked specialist doctors to fill the urgent needs in CHSLDs, whereas there were thousands of hands raised over many days and weeks which were visibly ignored? First, we have to understand that the situation has evolved a lot in the past week. Just yesterday, 800 people, more people have absented themselves from the healthcare network. So just in 24 hours, the situation is very different. We have a further 800 people missing. So when we were saying at the beginning, because we're missing a lot fewer, we're going to concentrate on qualified people, whether it be orderlies, nurses, specialists, generalists. I think that was the correct response at that moment. Now we're at a different stage. We're missing 9,500 people who are qualified. And we've asked 1,000 soldiers. We are going through Je contribue. At the beginning, when we're looking at the people who wanted to be, volunteers, we're trying to find people who had qualifications in the health network. Now I'm telling you that what we're looking for is a lot of just hands, but people who are still ready to come full-time, because we don't want there to be too much rotation of staff from one day to the next. So we're looking for full-time people. But taking into account the 900, 500 people missing in the health network, we're starting to look for, especially, extra hands. So at least 1,000 military staff, but now we're calling a lot of people who said that they would be volunteers, people who want to come work full-time, even if they don't have qualifications in a health setting. We'll be adding people, we're adding students in a very significant way. So the situation has evolved quite a bit in the past week, and, well, we'll see how it continues evolving in the next few days. Dr. Arruda, I know that you have a preparation happening, or a presentation rather. You are going to be recommending to Quebecers to wear masks, especially when social distancing is not possible. But tell us, for the people at home, to understand correctly, is this going to be a recommendation? What will happen to those who do not respect that request of wearing a mask? It will be a recommendation, a pretty strong recommendation, especially when people take public transportation and they cannot respect the distance of 2 meters. However, the measure is not, we cannot make it mandatory because of its level of efficacy. Legally, it would be excessively easy to contest, so it would be a strong recommendation. And I think that people, what is really important, people who have symptoms, don't go out. I think that it will become, a sense of, good citizenship, or being a good citizen. The means will be simple enough so that most people can make their own masks, or so that they can be adequate. Adequate so that they can use it when they go outside. A question for Ms. McCann. In light of the progressive reopening of operating units, how are we at with the stock of medication? There's been some improvement. We have ordered a good quantity, and now I'm very prudent saying this. We have a kind of guarantee that we will be receiving them, but in the present context, we are waiting to receive it to know that we have the order. But let's say that with the exercise that we went through in all establishments with the INEF, the Institute of Excellence for the Correct Management of Medication, as well as the substitutes that we can use, what we've done with suppliers, we are in a better position, but that does not allow us to open up elective surgeries at large. So, of course, we've always done the urgent and semi-urgent surgeries that were required, but now we'll be opening more on the semi-urgents that could wait, but now after a month or 7 weeks, 6 weeks, can no longer wait. Of course, they are becoming urgent, and perhaps in certain regions we'll be able to open a bit more in elective surgeries, but we have to be very prudent, and that is why there's been very important work done over the course of the past few days with the president of the Surgeons Association of Quebec. There's an entire team at the ministry to prioritize surgeries, because that's important. It has to be said. We have to have an exercise that makes as much clinical sense as possible. And once again, I wish to reassure the people who are waiting that there's an entire very rigorous exercise being done to evaluate in each establishment what the priorities are in terms of surgeries. That's an imperative, and it is being done. And when I say that it's being done today. Taking into account the emergency, the seriousness of the situation of the people, and I'm talking to you in every domain, cancer, neurology, cardiac surgery. So when we open up a little bit more, we have to have very clinical criteria, taking into account the medication, taking into account the availability of the workers as well. So we trust that we'll be able to increase to 50% for many establishments the volume of surgeries throughout Quebec. There may be, things that will vary from one region to another, one establishment to another, but generally speaking, that is what we're going toward. Collective immunity, the strategy that we are adopting, why not having done it 6 weeks ago? Would the results have not been the same? I mean, the 6 weeks that we just went through that we might have lost? What has to be understood, and I said it, the time to stop was absolutely essential to see how the virus was going to behave and to maintain a care capacity. Because if we had not made that full stop, we had to make a confinement. It's easy to shut things off. It's, social acceptability wouldn't have been there either. We could not allow ourselves to let the virus penetrate and multiply within the population. We really would have seen an important peak. Now, you have to understand as well that confinement, there's a question, if you allow me, of immunity, collective immunity that we wish to reach. But also there's societal functioning. There are perverse effects to being confined for a long time. There are children who we feel right now, the DPG signaling are going down. That means that there can be more violence. There can be aggressive behavior. There's questions of mental health. There can be all sorts of doctors telling us it's not just a question, I would say, of immunity. It's also a question of being able to function within society. There are people who are more vulnerable as well, who don't always have the means, who will be looking for resources elsewhere around themselves, who are affected right now by the confinement measures. So there's that as well that has to be taken into consideration, because it's not just the illness that I would tell you that is associated to the coronavirus, but there's an entire mental health aspect, the entire life of those individuals, the depressions, the dependency, alcoholism, all sorts of things. Addictions, it's impossible to remain entirely confined. So that is why we had to do it, to avoid that our healthcare system not be able to do what it has to do. So we have the very unfortunate situation of CHSLDs, and we can stay in the same mode, but be careful. As said the Premier, it has to be gradual, and it's not because certain groups of activities will take place that are elderly and more vulnerable, that certain people who have chronic diseases or who are at risk will be able to freely walk around as if nothing was wrong, because we still want to protect those people. Hello, concerning the strategy of natural immunity, I imagine that knowing the rate of immunity of the population will become a very essential data. Do we have an idea right now of the percentage of Quebecers that would have been infected by the virus? And also, will we be able to adopt methods such as random testing to know what that rate is? Your questions are very pertinent, and if we knew, it would help us decide the speed at which we can turn things on. The proportion is probably not very high. A maximum of 10%, perhaps between 5 and 10. Probably, that is what our experts are telling us. But we'll see. We might be surprised. It must be a lot higher in the metropolitan area and in Laval than it is in the Bas-Saint-Laurent area, where this, virus did not circulate. So what is going to be done is, first of all, we're going to reopen and see how the virus appears in the population. We will be doing random tests in certain territories in order to try to document the transmission rate as such, and particularly as well what we call serological studies. That is to say that we'll be taking samples with certain groups of population to be able to identify what the proportion of individuals is. Because many people have been infected, probably, but when I say many, it's in the limit of what I was saying. So much the better if we've reached 50% as such. But that would really surprise me. Taking into account, I would say, the operation and the non-impact, excluding CHSLDs, but the non-impact that took place in our hospital. Because if it had circulated that much, we would have had more cases, that's for sure. We can see that certain states are using the tracing technique like in New York, where they've created an army of investigators to find those people more quickly, the progression of the infection. In these studies, do we know how many people are working on that in Quebec, and are those efforts going to be increased with deconfinement? Yes, it will be increased. We're asking our teams in the same way that we're asking companies to get ready to work differently. We are increasing the capacity of public health teams to increase that capacity. So there's criteria of the WHO that are being done. One is, say, to be able to quickly, an example, construction site. There's a construction site, and we realize that 4 workers are ill. Well, we have to do the investigations excessively quickly to be able to go back to the source, if possible, to get in touch with the families, to avoid for that outbreak to become, to create other outbreaks. So as soon as there's a case, investigate, limit, and avoid the transmission. Identify what would have been the factor in the environment that would have caused the virus to be able to be introduced. Mr. Premier, we understand that you are writing the book and you're writing it as we go along because it doesn't exist. Today I felt in your call that it has been multiplied for a few days, a sort of desperation. Am I wrong? No, I think that the past few days have been difficult, but the message that I wanted to send today is to not get ourselves down. On the contrary, we can work hard at taking control of the situation in CHSLDs and to try to create hope as well with the reopening. And the message that I wanted to send today was to say, when we understand better what the concept of natural immunity is, it becomes less scary to reopen gradually. It even becomes something that can be wished for the health of our society. So that's good news, I think. Of course, we are not going to, the disease didn't forget us. Of course, the situation is difficult in CHSLDs for all sorts of reasons. But if we look at the other world, that is everything that is apart from CHSLDs, we have reasons to be optimistic. We're seeing all sorts of news all over the place. We saw it again this morning. We can still see nurses that are wearing garbage bags to protect themselves. There's the outbreak, I was told, in hospitals, the Maisonneuve-Rosemont, Charlemagne hospitals. As far as the gowns are concerned, it's true that the situation has been a bit tight. But yesterday, we received a good quantity of gowns. So they have to be distributed as quickly as possible. And I know that there was an establishment in Montreal that was missing gowns, or was almost missing gowns, and we distributed quickly. So we have noted the places that you mentioned because we did receive the gowns, and we are distributing them as quickly as possible. And we are going to make sure, I was speaking yesterday with the new Deputy Minister, Ms. Savoie, who is going to, in part, is going to have that responsibility with the ministry's team. Mr. Gendron has done an enormous amount of work on that, but there's a lot of work to be done in this pandemic, so he'll continue. And we were thinking that it's also a question of logistics. The equipment has to go quickly and directly towards the points of services, because there's 35 establishments in Quebec, but there's a lot more points of services, whether it be in the private sector, the private CHSLDs, the intermediary resources. So it really has to go much more quickly and without delay. So we have noted, and we've made sure that those hospitals that you mentioned have what they need. Here as well, we have noted what you just said. I know that there's been a few in Montreal, in a few hospitals, and we have brought them together. So it's not excluded that at some point there can be an outbreak, particularly in Montreal. But we are taking all the measures to curb it quickly, and that is what we have to do. And usually things calm down. We can stamp things out. We move the patients to hot zones, and we maintain the cold zone, excluding patients with COVID-19. And of course, we have to, in those outbreaks, there are employees that can be infected, and we remove them for a period of quarantine. And it's not excluded that we will have outbreaks, but we do curb them quickly in the ones that I've been told. English questions now.
Hi, Mr. Legault. Some people say that Quebec delayed protecting seniors in CHSLD. The Conseil pour la protection des malades has filed a complaint with the Quebec Human Rights Commission alleging discrimination. Should the government have acted sooner to protect seniors' homes?
I think we did what we had to do as soon as we saw that there was a problem. But there was an evolution, an increase in the problem day after day. So as soon as we saw that we didn't have enough people, we've asked, for example, for the army. So I think that it's easy after or during a crisis to say, oh, you must have been better prepared before the crisis. It's true. But everywhere in the world, what I see is that people are under pressure, that the healthcare system everywhere in the world is under pressure. So we'll have the opportunity eventually to answer to those suits or whatever we'll have.
And about the back-to-school plan, teachers' unions and parents' committees say that they have not been consulted about that plan that will be released next week. They have many questions. Do you think they will be consulted before you release the plan?
I think that Jean-François Roberge, Minister of Education, he discussed with a few people, but I think that the master of the plan is really the healthcare. I think I'm not a specialist. The teachers are not specialists. What we're trying to do is to make sure that everybody is protected, but at the same time, we have, like I've tried to explain before, to gradually open our society, open our schools, open our companies, because it's the only way we'll get a certain percentage of the population with the immunity.
News.
Good afternoon. Following up on this question, Mr. Legault, you first said to parents to keep their children at home. Now you're saying that herd immunity is crucial. This is logic, but what do you say to a parent in front of you that is so anxious about this idea?
Okay, first, I'm telling the parents that nobody will be forced or obliged to send their children to school. So they have the choice.
You need them, though, to go back to school.
What I'm trying to explain, that it's a lot better to reopen gradually than to send 1 million kids at the same time in September with the flu and all the possibility of having a greater wave in September. So I think even for those families, it's better to go gradually and use the next weeks and the next months to go gradually instead of sending everybody back in September. Because unfortunately, we don't expect to have a vaccine solution in September. It can take a year or two. So we'll have eventually to return kids to schools, and it's better to go gradually than to send them all at the same time.
Second question.
Second question. It's a question from my colleagues. Every day we hear from nurses and orderlies that there is enough staff. There is not enough protective equipment, and they are overwhelmed and worried that they are spreading infections. And we hear from caregivers and families that seniors in residences are not being properly cared for, are not even getting food or water. Like you saw those stories in the last few days, right? So what do you say to Quebecers that are worried that their loved ones are dying or of neglect or are being exposed to life-threatening disease because of a lack of preparation in the long-term care network?
Well, I would answer two things, and I'll let Danielle complete after. But first, regarding the equipment, we have enough equipment. We have enough masks, enough gloves. We were tight with gowns, but it's solved, or it's in the process of being solved with Quebec companies. Regarding the shortage of employees, unfortunately, the situation is getting worse and worse because today we have 800 people more missing. So that's why we've asked the Army. But I don't like to hear those stories more than you, but we're trying to do our best in order that it doesn't happen too many times.
And the additional dimension is that we're going to send, we have already started to send the teams in the different CHSLD, the ones that are more in difficulty, teams to review with them how to do the prevention of infection, how to use the protective equipment. It's a very important thing because in CHSLD, there's a specific environment, it's not the same as in a hospital, and that support of the team when they've got it, it's very, very appreciated. We need more staff, undeniably, and that's why we're bringing in all those people, and including the Army. But we need also to support the people in the CHSLD in terms of what to do in terms of prevention of infection. It's not easy to do exactly what needs to be done. You need to think about it. You need someone to remind you. And we have the protocol. The protocol are there, but we need to help them to implement it better. And it's just needed, you know, in this situation because they're working so hard. We want to give them all that support. So we're going to do that with teams that have already started, and I think that's going to be helpful to those teams.
Thank you. The next question is from Philotier, Montreal Gazette, for Minister McCann and Dr. Arruda. If you go in stores in Montreal, it can be very hard to find mask, glove, and sanitizer. Since you are recommending people wear a mask when they can social distance, will you be making masks available for Quebecers?
In fact, as soon as we can have a high capacity, that could be something that we would done. But actually what we are promoting is, we call it, it's not a procedural surgical mask, it's a kind of cover of the face that people can do by themselves with some tissues, and there's going to be videos and I would say how to use the mask, and also there's going to be different tools to help people to do the mask.
Mr. McCann, you want to add something?
It's exactly the same. I think that's the best way to do it.
Thank you. Enough for Mr. Arruda again. The World Health Organization says it's not clear that people who have had COVID-19 have developed antibodies that will prevent them from getting the same disease again. What research are you using to say that exposing people to COVID-19 will immunize people against the disease?
We are not doing experiences in people. We are observing what is going on naturally. In fact, in Quebec, we have not having 2 or 3 phases of the disease. So it's not possible to do the disease, and nobody's going to expose a human to the virus to check that. So what is happening is probably in some countries like China, who are the first who are attacked. If there is another wave or there is another transmission, they can see that somebody who had already had the disease can be. And it's also based on, I would say, the knowledge we have about the coronaviruses, because there is like other viruses like measles. If you do that one time, you will never do that again unless you get a cancer or you're very, very old, which is not the case. But with coronavirus, it's like the flu. It's, I would say, the normal flu, not influenza, but the normal, I would say, cold. And then you can have sometimes the same cold or a similar cold with a similar virus. So it's why we don't have enough time to know exactly what it's going to be, but it's a supposition.
Thank you. The next question is from Raquel Fletcher, Global News. This morning, essential workers received their 4% bonus. We heard from one worker who received $72, and she's very disappointed. What do you say to her?
Well, I don't know who that person is and what she's doing, and the $72 on what basis. So I would need more information about that. But of course, the 4% is for everybody to recognize the effort, and the 8% is for people who are facing the COVID-19 directly. But I would need more information to comment on this. But again, it's a gratitude that we want to give to people who are working in the network, who are coming in to help us. I would like to have more information, obviously, about this situation.
All right. And next and last question from Raquel Fletcher. We are hearing that people are not being fed, not getting basic care. So while we are waiting for the army to come in, what are you doing to ensure that people are looked after? Why are caregivers still being refused access in many retirement homes?
Well, I think we did announce a few days ago that the caregivers were allowed to go in, but at certain conditions that they have to respect. And every organization has a particular situation. For instance, in Montreal versus in Bas-Saint-Laurent, the situation is not the same. So, of course, there are individual cases, and it has to be examined. But the general principle is that it's possible now for caregivers to go in, but as much as they don't put themselves in risk, and that the situation is stable in the CHSLD.
And concerning people that are not being fed, not getting basic care?
Well, that's why we are working so hard to get more and more people to come in, and this is something that is tragic for all of us to have the situation happening, and that's why we are working so hard to get more and more people in. Je contribue, the education, the doctors, the physicians, and the army. And we hope that we're going to be able to stabilize very quickly the situation and really get the basic needs to the basic needs of everybody. Because this situation has changed everything in the milieu de vie, especially in the areas like Montreal, in the greater region of Montreal. I mean, the work has changed completely. You have to organize very differently, and you have less time for different people. So we have 9,000 workers that are away, but on top of that, the work is requiring more time. So that's why the key is to get more and more people involved.
Thank you very much. Well, that's all the time we have. Merci à tous. C'est ce qui complète pour cette conférence.
Thank you, everyone. This puts an end to the press conference. See you all tomorrow.